You know HOAG. We've been setting the standard of healthcare excellence in our community for more than 60 years. But you may not know how much HOAG is investing today in health information exchange, what we call the HOAG HIE. HOAG HIE uses the latest technology to facilitate safe, timely, and effective patient-centered care. But what exactly is HIE? HIE gives you and all physicians in the community the capability to securely exchange patient information in an electronic format rather than relying on traditional methods like paper, phones, and fax machines. HIE is a resource for you as you care for your patients and collaborate with other care providers throughout the community. Why is HOAG investing so much in HIE? Simply because it's the right thing to do for the communities we serve. The HIE is already connecting hundreds of your colleagues. We believe that participating in our HIE will support you in your goal of delivering high-quality and efficient patient care. Whether you have an EMR in your practice or rely on fax machines and paper records, the HOAG HIE will help you meet the challenges to quality care and operational efficiency that crop up in your practice every day. As you know, your practice doesn't exist in a bubble, and neither do your patients. Collaborating with other care providers is an essential part of your world. What if you could coordinate care efficiently and effectively and maintain complete visibility into the results of the care being provided to your patient? The HOAG HIE makes that happen. First, the HIE makes it simple for you to send, receive, and manage referrals with other community providers. You can set up your own secure electronic referral network, inviting the providers you work with most to participate. The system helps you close the referral feedback loop, keeping your patient's entire care team up to date on the patient's health. Second, the HIE makes it easy for you to collaborate with HOAG, delivering up-to-date patient information from the hospital to your practice in real time. The HIE can send patient information directly into your EMR. If you don't have an EMR, you can receive this information through autoprint and a web-based inbox. Not only do you receive information from HOAG, you can also place both lab and scheduled orders for HOAG services and send them electronically to us, whether or not you have an EMR. How much more empowered would you be to achieve your goal of providing the best patient care if all the information you needed about that patient, their latest lab results, their medication history, or their discharge summary from a recent hospital stay, was available when and where you needed it to make the most informed care decision? The HOAG HIE makes that possible by aggregating patient information throughout the community and making each patient's longitudinal health record securely available to authorized care providers. All you need is a computer with a standard web browser. You are keenly aware of the business aspects of practicing medicine. Administrative functions like sorting and filing paper reports, scanning results to insert into an EMR, placing orders to the hospital manually, or making phone calls to manage referrals require a lot of time and resources, time that could be spent improving the quality of care. The functionality offered by the HOAG HIE helps you streamline practice operations so that you can focus on patients rather than administrative functions. The healthcare industry is full of buzz about market trends, like the shift from a fee-for-service to a fee-for-value reimbursement model. And government is getting more involved, legislating changes like meaningful use that reward physicians who demonstrate quality improvement using new technologies and penalize those who don't. How can your practice address government mandates and prepare for changes in the way successful patient care is measured? The HOAG HIE can help. Not only are we committed to helping you meet the federal government's meaningful use requirements, but the HOAG HIE also establishes a technological foundation for the kind of communication, collaboration, and care coordination that will be necessary in the evolving healthcare landscape. For example, in future phases, the HOAG HIE deployment plan calls for functionality like population health and disease management to help you track the health of your patients. At the end of the day, HOAG's mission as a not-for-profit, faith-based hospital is to provide the highest quality healthcare services to the communities we serve. key to this effort and to navigating the evolution toward a value-based healthcare system is engaging patients in their own care. In fact, our community is already demanding more accessible information and a better healthcare experience. The HOAG HIE will make communicating with patients and engaging them in care easier and more efficient. In coming phases, the HIE will provide a patient portal to engage patients directly and the ability to share data with patients through a personal health record. Regardless of the technology currently in place in your practice, you can reap the benefits of the HOAG HIE. We are committed to finding a sustainable electronic health record and exchange solution for every caregiver in the community. In fact, the HIE adapts to serve paper-based practice workflows and practices with full EMR implementations. HOAG is integrating with many EMRs today and is committed to continued integration with certified EMR systems in our community. Getting started with the HOAG HIE is easy. Here's how. If you don't have an EMR, when your practice signs up to participate in the HOAG HIE, we will assist you in downloading, installing, and configuring a small and secure piece of software to a computer in your practice. Once this software is installed and configured, you can begin to receive results from HOAG, place orders to HOAG, and collaborate electronically with other practices in the community. If you have an EMR, when your practice signs up to participate in the HOAG HIE, you'll receive a menu of options that lets you specify what data you'd like to receive into your EMR and how you'd like to receive it. Then HOAG will assist you in downloading a small piece of secure software either to a computer running in your practice or to your EMR vendor's server. Once installed, your secure software communicates with HOAG and other community providers who are also participating in the system. The end result is that you can communicate with other physicians and care providers in your community directly from your EMR. As a trusted and nationally recognized healthcare leader, HOAG is committed to providing the highest quality services to the communities we serve. HOAG's Health Information Exchange is a demonstration of our commitment to provide secure access to clinical data and to support your efforts to promote safer, timelier, efficient, effective, equitable, patient-centered care. We invite you to join with your physician peers and work with us. Together, we can continue to improve the quality of life in our community. To get started, simply visit our website, hie.ehoag.org/enroll.